You would think that after millions of years of evolution and the developed ability for the hypothalamus to set a high set point and invoke mechanisms to heat up your body's core temperature, and to lower that set point and invoke mechanisms to cool off that core temperature, that these temperature changes would have an important role to play. Well, that's been actually hard to figure out. There are some studies that suggest that you get over bacterial infections more quickly when your temperature is set higher, but there are other studies that aren't so sure. What we do know for sure is that fever is an important sign when it comes to deciding a differential diagnosis in someone's condition. We've seen it already when it came to cough. When we were trying to decide whether someone has an upper viral respiratory tract infection or a cold and discriminate between that and a pneumonia, sometimes fever is what helps us decide whether to send that person for a chest x-ray. Similarly, fever can help us decide whether someone has an infection that's more serious or less serious. And that's when it becomes an important sign. Fever becomes an especially important sign in vulnerable populations. And when I say vulnerable, I mean people whose immune systems are compromised. Immune systems can be compromised by a bunch of things. Let's start with age. If you're really young, let's say under 3 months of age, or really old, well then your immune system may not be working as well. And because of that, we interpret fever in old people and in really young people, let's say under 3 months of age, more seriously than we would in your average adult. There are other reasons that your immune system may be compromised, and in these situations we'd consider fever to be more important. One of them would be if your immune system is compromised by disease. Let's say you have HIV. Well, a fever in that case would become more important. Or if you're on a drug that compromises your immune system, like a steroid for a chronic inflammatory condition, or you're on chemotherapy because you have cancer, well, fever in those conditions would be considered more serious as well.